Thanks for listening to today's episode of Medical Device Global Market Access by Pure Global. For years, the European medical device industry has been anticipating the full implementation of EUDAMED, the European database on medical devices. We now have a concrete timeline. The European Commission has officially published a notice declaring that the first 4 of the 6 EUDAMED modules are fully functional. This notice, detailed in Commission Implementing Decision EU 2025-2371, is the starting pistol for the mandatory transition period. It is critical for all economic operators placing devices on the EU market to understand these new, hard deadlines. The 4 modules now confirmed as functional are actor registration, UDI and device registration, notified bodies and certificates, and market surveillance. Let's quickly review what this means. The actor module is for registering economic operators like manufacturers, authorized representatives, and importers to receive a single registration number or SRN. The UDI and device module is the core of the system, where all devices must be registered with their unique device identification data. The Notified Bodies and Certificates module provides a central repository for all issued certificates, increasing transparency. Finally, the Market Surveillance module is for use by competent authorities to coordinate their oversight activities. The most important information for your planning is the timeline. The publication of the Commission's decision starts a countdown. The mandatory use of these 4 EUDAMED modules will begin on May 28, 2026. From this date forward, using EUDAMED for all new registrations and data uploads related to these modules is no longer optional. It is a legal obligation. All new devices must be registered in the database before they can be placed on the market. There is also a deadline for registering legacy devices, which falls in late 2026. This shift from a voluntary to a mandatory system has significant consequences for go-to-market strategies and internal processes. Companies can no longer postpone their EUDAMED readiness projects. You must ensure that all required data for your devices is collected, validated, and structured correctly for upload. This includes all basic UDI-DI and UDI-DI information. Internal teams need to be trained, and quality management systems may need updating to incorporate EUDAMED procedures. The remaining 2 modules, for vigilance and clinical investigations, will follow a separate timeline once they too are deemed fully functional. The gradual rollout is now a reality, and the clock is ticking. If your organization needs assistance in navigating the EUDAMED registration process, developing a data readiness strategy, or understanding your obligations under the MDR and IVDR, please check out Pure Global. In the description of this episode, you will find links to our free AI tools and database to help you stay ahead of regulatory changes. Thanks for listening, and we will see you next time.